Today we're getting under the hood with Dr. Chris Creatura, a NAM-certified menopause expert, sex educator, and reproductive freedom advocate. She is the founder and owner of her private practice of gynecology, menopause, and sexual medicine, and is a clinical assistant professor of obstetrics and gynecology at Weill-Cornell Medical College, and the only full-time New York City-based Gynecologic Fellow in female sexual medicine, certified by the International Society for the Study of Women's Sexual Health. She is a proud graduate of Barnard College, Harvard Medical School, and the Leadership Training Academy of Physicians for Reproductive Health. She currently serves on the Political Action Board of Planned Parenthood of Greater New York and is the only gynecologist member of the longest-running sexual therapy program in the United States at Weill-Cornell Dept of Psychiatry, founded by Helen Singer Kaplan. She's a feminist healthcare provider and feels her life's calling is the destigmatization of women's sexual health and promotion of women's sexual autonomy and health. Welcome.
Hi, thank you so much for that generous introduction. I am so honored to be included in your exploration of Women's Sexual Health Month. Like you said, my mission has always been to promote honest education about sexuality, especially as it relates to bodily autonomy and to freedom. And I became a gynecologist to investigate and address female suffering, to counter the normalization and acceptance of female pain, violence against women, and ignorance of things that don't affect men. Because my specialty is the one where everything not male is siloed. And while it means we're able to be primary care providers, technical surgeons, contraceptive and abortion providers, high-risk pregnancy specialists, and menopause miracle workers, we also have expertise in infertility, infectious disease, pelvic pain, oncology, urology, psychiatry, endocrinology, dermatology, orthopedics, breast disease, rheumatology, and cardiology. And it's an extraordinary burden for people in my profession. It's also an opportunity for creativity and reinvention, because this field encompasses all of women's healthcare, along with a need to combat misinformation around women's health. There's been a huge evolution in my field into multiple subspecialties during the 4 decades I've been a women's healthcare provider, but I've had the privilege of participating in most of them. And one of the most important things I do is simply tell the truth about women's lives.
Well, I really appreciate that opening because it allows us to really delve in to your journey and your history. And so, of course, you've done an extraordinary, you commented on 4 decades of affecting women's health. What was that inflection point, that inspiration that got you on the journey into medicine and into women's health?
I've always thought that women's health needs are not prioritized because the system really considers males the norm. And there's a little special consideration in our educational process about females just when we're reproducing. And this kind of exceptionalism has improved enormously. I think there's finally a cultural acknowledgement of the suffering and marginalization that women endure. And the entrance of so many women into diverse fields has changed the way we practice and the topics that get studied. But the gender bias that pervades most cultures clearly affects the medicine we learn and the health policy that determines access to care. When I was a child, gender struck me as confining and unjust. And I had difficulty with my behavior because I was more masculine, assertive and independent. I questioned authority. I wore pants. I didn't sit still or listen to the teacher. Yet I somehow felt female. And I learned as I was very tall and had a very adult appearing figure at a young age that my femaleness put me at risk in the world. This realization was amplified by the simultaneous arrival of puberty and Ms. Magazine. And I read every issue from its inception and really had my consciousness raised by the exposure of injustice towards half the world's population. I was shocked by the famous photograph of a woman who died after an abortion in a Connecticut hotel room. The failure of our healthcare system to prevent this when we had the means to do so was appalling. But it was a symbol of the everyday suffering and casual violence that the culture imposes upon women. When I was 14, I met Dr. Mary Calderon. She was the director of the Sex Information and Education Council of the United States. And I realized later that this was the first time that I met a female physician. She was a tall, sexually honest psychiatrist who had worked for Planned Parenthood and advocated for sexuality education. So I discovered who I wanted to be. It is so hard to convey to others who had role models how difficult it is to envision yourself as someone you've never seen. And I didn't meet many people like Calderon during my training, but I continue to fantasize about it. And now I have so many younger, accomplished colleagues that use their voices in advocacy that the dream is becoming true. I really thought at first I wanted to be a psychiatrist before I knew how beautifully OBGYN would allow me to synthesize psychiatry, primary care, surgery, reproductive health care, and sexual medicine all into one career. One of my early volunteer jobs was at Planned Parenthood, and I realized that I would be happiest supporting and advocating for women in the reproductive health space. Perhaps because subliminally, I was learning that mainstream medicine wasn't always engaged intellectually or politically in getting the best care for women. When I attended Barnard College, I read Susan Brown Miller's book, Against Our Will, Men, Women, and Rape. And then I volunteered as a counselor for the Rape Crisis Intervention Program at St. Luke's Hospital. I think it was the first such program that was affiliated with a hospital emergency room. And I learned how pervasive and varied are the experiences of sexual assault and gender harassment. So what I really wanted to do as a physician was not just cure people, but support women going through life events without having those experiences invalidated. And I fantasized about a sex advice radio show a la Dr. Ruth, who I did listen to on a Saturday night radio when she started out, but I didn't have a cute accent and there was no internet and never mind social media platforms. So I had very few creative ideas about how to educate beyond my own exam room or the interaction I had with students and residents. Once I went to Harvard Medical School, I learned that even within some of the best training programs, women's health was neglected. Our bodies and viewpoints were not prioritized. When I decided to continue my postgrad training back in New York, I was bluntly informed by an attending physician interviewer that obstetrics and gynecology is about pap smears and hysterectomies. And if I wanted to educate women, I should become a social worker. And I really do think he meant well. Our field was so different and hierarchical then. Patient-centered care was just not a thing.
I'm kind of curious. So, you did all this reading with Miss Magazine, you had this inspiration with this psychiatrist, as you went on your journey, like, how was it in terms of getting your voice? So, when you went to Harvard Medical School, what was that experience like? Because, when you said you've been practicing for nearly 4 decades, I would imagine things were a little different there. What was your experience like as a young woman in medicine and as you journeyed out and created your business?
Thanks for that. The experience was different and it was rapidly changing. At the time that I entered medical school, women only made up 10% of physicians, but to be fair, they made up 30% of our entering class because I do think that the institution wanted to change that. But the absence of role models is the piece that I really think made an enormous difference in where I went in my life. So I felt like there was a denial during the 1980s of any differences, that you were not supposed to call attention to gender. And if you were going to be accepted into this world that had always been just for men, then you had to pretend that you actually weren't a woman at all. And if you called attention to that, then you would actually expose yourself to a great deal of hostility. So I learned to keep things a little on the down low, not be so vocal, and just try to enjoy the fact that my field was actually being filled with young women. But I still didn't really quite find my people. I came back to New York to do my OBGYN residency at the peak of the AIDS crisis and the highest teen pregnancy rates. And I had excellent training, but most of it was during the last years that residents lacked limits on their work hours. And this really kept me from focusing on the why of my presence. I was just trying to survive the exhaustion of it all. I built a personal practice from nothing. And after nearly 20 years of being a busy GYN surgeon and an overtaxed obstetrician, I decided to pivot into sexual medicine and focus on advocacy, education, myself included, and retrained myself as a sexologist and menopause expert. And my field has evolved and subspecialized since then. And now we have family planning fellowships. This is the career I was seeking, but there was no model to envision it or make it happen. So I became involved with Physicians for Reproductive Health. And I was selected as a fellow for their Leadership Training Academy, which is a year-long advocacy fellowship where this organization trains abortion providers in advocacy and speaking out and trying to educate people about abortion care. So I got to work with people who were my people, the ones I was looking for that I didn't find during my training, and I certainly didn't find any to look up to. And I like to compensate for this by elevating and supporting these providers. I'm really lucky to be part of a network of committed, smart people who advocate publicly for reproductive health. The authority and wisdom that healthcare providers can bring to debates about abortion and contraception and pregnancy care are so critical to getting those who are jaded about politics as usual to really listen. I had been to Albany to lobby our state legislators on behalf of the Reproductive Health Act here in New York and the Comprehensive Contraceptive Coverage Act prior to being accepted into the Leadership Training Academy. And I've had the opportunity to do more advocacy in DC and locally since then. When the New York City Council held hearings on a measure that would prohibit limited service pregnancy centers, also fake clinics, from using deliberately deceptive tactics to confuse and intimidate pregnant patients who were looking for care, I testified on behalf of the women of New York City and was amazed to learn I was the only gynecologist to testify in person. While there were religious leaders, politicians, public health advocates, ACLU reps, no one else was an actual abortion provider. It's stunning to think about how often those with the most expertise are excluded from the discussion. Witness what we've seen in Congress, at the Supreme Court, or the FDA, right? And as a result of that testimony, I was invited to serve in the board of directors at Planned Parenthood of New York City, which I did for many years, and I still serve in their political action committee. So while I'm accustomed to more immediate or tangible results after delivering babies or surgically removing tumors, I am committed to speaking up and voicing the need for better access to education and services, and spreading fertilizer around the many places where it will be cultivated by people like you.
How do you feel like being that you've been at sort of the early stages of this and now it's coming to life and you're able to witness the very thing you've been practicing?
I think it's exciting. I want, like I said, I want to support the people who are having the career that I couldn't see for myself, right? I mean, one of the wonderful things about being around for this long is that you do get a little bit of this feeling that you have this experience, you have the history, and you can actually use that experience to elevate other people who are changing the future, right? Because I think that reinventing yourself is something we all need to do in our profession. And if I was still delivering babies, I would be bored. I love delivering babies. It was emotionally rewarding, but intellectually no longer challenging. And I think we all need to do this professionally, is to find some place we can go where we get more challenged. So my reinvention also included a re-education as a sexual medicine specialist, which is another neglected area of medicine that affects women disproportionately, because we're not all created equal and only some of us can get pregnant when we have sex, right? There wasn't any formal fellowship for this training either, and I discovered through several professional organizations that didn't exist in the 80s and 90s that I could self-educate, and my clinical experience with patients had already been my training ground. We learn about sexual behavior and sexual problems if we ask the questions and we listen to our patients. So I became involved with the International Society for Women's Sexual Health nearly 20 years ago, and I dutifully attended every sexual medicine conference and training program I could find. In 2008, I was invited to join the sex therapy program you referred to, and I'm the only gynecologist member, and I've served as the gynecologic consultant to other sex therapy conferences here in New York. As a faculty member, I've been able to lecture students and residents and even colleagues of the New York Gynecologic Society on sexual medicine for the gynecologists, because we know the equipment, right? We're the best suited for it. But the education and support that I've received through ISHWISH and other sexual health organizations like Asst, which is the Society for Sex Therapy and Research, the World Association for Sexology, the International Society for the Study of Vulvar Disease, and the National Vulvodynia Association, all have permitted me to create a local and international network of sexual medicine experts with whom I consult and collaborate. So if I can't be the person who is going to have a platform or have published 30 papers, I can still go to these conferences and meet the sex researchers who need coddling, who need stimulation, who need support. It's a value heavy experience, right? It's also really fun hanging out with people who care about sexual rights.
In a way, you've conducted qualitative research for 20 years, right?
Right.
So, I mean, imagine that. I mean, you really do become an expert at that. So talk about that, because I think that's an interesting way of looking at it.
Yeah, I feel like, I think of myself sometimes as a cultural anthropologist, right? Because we have this intimate experience with so many individuals. But the stories that I have the privilege of hearing from my patients every day are universal issues. They never stop being relevant. Confusion about one's anatomy, shame about sexual behavior, physical violence and gender harassment, stigma over pregnancy decisions, not just abortion, but even one's experiences being pregnant, giving birth, feeding and raising children. Menopause is finally having its popular culture moment, but I've been prescribing hormone therapy to women for health preservation indications for years. I never really changed my treatment paradigms after the WHI study was released and misinterpreted. So professional societies were, until very recently, reluctant to endorse preventive treatment and only vaguely supported short-term interventions for symptomatic women. I always practiced more individualized medicine. And I do very strongly believe that we've shortchanged women by making them afraid to use hormones. I've realized in these last few years that all the confusion about sexuality, pregnancy, abortion care, and menopause is all linked to a cultural habituation to female suffering. And we're so accustomed to women not getting what they need, we don't envision a world in which that happens. Medical misinformation exists in this ecosystem of misogyny, racism, and fear. So by speaking out, changing how we take care of patients, we can envision a world in which people actually get the education that they need.
You have such a rich, like multi-layered experience. How do you feel? Do you feel we're progressing? I mean, with Roe v. Wade being overturned, how do you feel as this expert across the continuum of women's health, or are we progressing?
I think that any kind of movement that moves forward there's going to be pushback, right? And we've seen this with feminism. We've seen it with civil rights for any marginalized group. When you make steps forward and you threaten people who have power, there's going to be pushback. But I do think that when people lose a right, they become more assiduous in their determination to get it back, to acknowledge the importance of it, to discuss it in a new context so that people can understand how that right, how that care has benefited so many of us. So I think it's really forcing us to look at women's healthcare through a totally new lens. And I feel like there is a cultural appetite for that. So, when I talk about medical disinformation and how it's used to keep women silent, I think that probably since 2016, that appetite is changing. And that's actually a really important part of why it's easier to be who I am in medicine today than it was even 10 years ago.
Has there been sort of a favorite, a time in your career that you have felt that things are just lining up based on everything you know and your expertise, the patient you're seeing, everything that you're doing? Because I think what's interesting about you, Chris, is the fact that you aren't just treating patients. You aren't just educating. You are always learning in the process. You are always self-educating and educating through conferences. So is there any moments you'd say throughout your career that have really stood out as those aha moments, if you will, inflection points?
Well, like I said, we can go back to understanding the importance of seeing yourself in somebody else. And then you have to take that, right? Like when I think about somebody like Mary Calderon, who I didn't know. I mean, I spent 45 minutes with her when I was 14. I found other people through these organizations and these meetings that I've told you about. I went to Turkey last year and I met another woman who grew up a town away from me, who's actually been writing about sexuality education. She also met Mary at the same time, the same age. I listened to her career. It's totally different from mine. She's been in social work. She's a religious advisor. But the impact of meeting someone like that had a similar yet dissimilar trajectory, because we have to understand as women that if we don't see anybody who has the power to do the things that we imagine when we're young, it really keeps us from becoming our best selves. So I feel like now that more than half of women are physicians, and finally, really only in the last 5 years, do we have a lot of women who are heads of medical school departments, heads of hospital departments, have leadership positions, not just women, but non-white women, women who come from different backgrounds. All of this is so critical to diversifying the workforce and getting people who don't have the same background to understand that we do share the same problems. We experience them differently, right? It's like we're all in the same storm, but we're not in the same boat, right? And we have to realize that my experience with my identity is going to be different from another person's experience whose identity is totally varied. We have data now that show that women have better outcomes when they're cared for by women, that Black people have better outcomes when their physicians are Black. I'm sure there's endless data on this topic, but identity is important and it has real measurable impact. So I feel like that change has occurred very, very recently. And I wish that I had seen it earlier. It would have been nice. But I think that the perspective that I have that it wasn't there is also valuable. So I want to be able to use that.
And I think what's also interesting, Chris, is here you are as this prominent physician in New York City. You have an amazing practice. You're doing this incredible work from sexual health and sexology and menopause, and of course, everything in between, because clearly you're passionate about things. Talk a little bit about the things that are unrelated, however, that inspire and make you who you are professionally.
Well, Elizabeth, I think that one of the things that really brought me back to New York for my training was wanting to be in a really rich, diverse community of people. And as you know, there's no place on earth like this city for that experience. It probably wasn't the best professional decision. And certainly there were people in my medical school who thought I really kind of blew it. But I really feel that being in a city like this, where you are in the street, on the subway, going to cultural events, and hearing languages from all over the earth every day, is part of what makes you sensitive to other people's life experiences and able to really understand that your needs, while they may be shared with many people, they're occurring in a different space, right? So I love being here in New York City, and I'm not sorry that I'm here. I think that the richness of this experience here, the cultural experience, the arts experience, is part of what makes it really fun to actually be a physician. Because I used to joke that vaginitis is boring, but the people that come in with it are fascinating. And I mean that because I have that opportunity to engage with all kinds of people here. I wouldn't have that everywhere else. So that's actually what really drives me, is to have a new experience with a similar problem.
And I love the notion of, being in a diverse place, being affected by diverse thinking, diverse everything, to your point. It's, it's seeing the people.
It makes your life richer, right? We all want to have rich lives.
Exactly. And you've been at the forefront of these problems before a lot of the people who are now stepping up and are part of it and very influential socially. You've been at the forefront of it. And so,
but I want to encourage those people because, like I said, I didn't have that imagination 40 years ago. And when I see people who are able to, when I listen to people who have great platforms, who are really educating, like you and so many other women physicians I know who are doing podcasts, who are actually getting information out to the public, that they understand the power of these platforms and they've learned how to use them. I admire them. And I'm also relieved because when I listen, I think, oh my goodness, that's exactly what I've been saying for 4 decades. And this brilliant person found a way to get it to hundreds of thousands of women, and women well beyond our city, well beyond the country. And it's so inspiring to see how that actually impacts the quality of the care that women get. I think that the pandemic also created an opportunity for a huge amount of creativity. And I think that many women started to understand that with the kind of technology that I'm using to speak with you right now, that we could use this technology to provide telehealth services in a way that I think traditional physicians would never have done. It would have been much more transactional rather than educational. And I think that having more women physicians and physicians engaged in advocacy has enabled many people to provide abortion via telemedicine, menopause care via telemedicine, sex education. I used to tell people when they talk about, what do you think about pornography and how it educates or miseducates people? I would say that I wasn't really an expert on pornography, but that I felt like the use of sexually explicit internet materials was a great educational opportunity, and that we should figure out how to use it because it was going to be the first sex educator for everyone on the planet. And I think that there are people who are learning how to use that technology.
I think you're right. The pandemic has really changed the dynamic of how we exist as a planet, as people. And I think what's interesting about that for me is the fact that the world is now like officially flat. It means that we can have this global community. You can be a global health educator and physician, maybe not treating people globally, maybe, I don't know. It depends on what your practice is, how far you extend, but certainly the ability to educate and have a voice and share your stories, and so I think you're right. I think it's very interesting, how things have changed over the last, I'd say 4 or 5 years, just from the ability of being able to speak and share and educate more and more people and not have it just be something that is local, if you will.
Because we know with the way that our healthcare system is constructed, that there's a separation between those who have and those who haven't. And you don't want people who are lacking access to care to lack access to information. If you give them information, they can find ways to access care. So being able to have platforms that they're not economically restrictive is key. I just didn't know how to do that before we had this technology. And I think that watching people use the technology in such favorable ways, we have to make sure we find out how we can distribute it so that it gets to the people who need it most. You're not going to be able to get the kind of personalized healthcare that you really want in a 6-minute visit that insurance will cover. And insurance isn't really interested in supporting healthcare that involves education and prevention. They want us to do things to people and take things out of people. And that's not always the best medical care. But I think through health education platforms that we can reach people in the public and educate them, and then they can go educated to their healthcare providers and hopefully get more of what they need and have more satisfying interactions.
It is so critical that you use your wonderful expertise to give voice to all of your knowledge that can support them so that they go in. I mean, we created under the hood of Women's Health, the story sharing platform, so that women and even husbands and fathers could be empowered to go into the doctor's office and know how to ask the right questions, know how to listen for the answers that they need, so they can move forward, making educated and informed decisions. So I think this is like, what do you see the future, women's health and healthcare in general, given the current healthcare system? What are you imagining the future to be?
Well, I like to imagine that there is a way to use education through this type of medium to reach everyone. I'd like to imagine that that's the case. I'm hoping that by using educational platforms that we can ultimately let doctors practice medicine and have humans make their own medical decisions without interference. But this also requires physicians to use our expert voice in everyday conversations. and to ensure that not only do people have bodily autonomy, but they have accurate information, right? And that's really what sexual health encompasses: bodily autonomy, safety, accurate health information, and access to care. I think it can be done, but you have to have the will. And part of that, I think, as much as I want to liberate some of healthcare from legislative interference, I also feel that you have to have a government that is benevolent in its mission to create a healthy society. I think it can be done. It's not that expensive.
I love that. That's wonderful. I couldn't agree more. Wouldn't that be beautiful if we had a government that wanted to create a healthy society?
But public health requires public trust, right? And what we've had, unfortunately, is a lot of disinformation that creates distrust. And whether it's a pandemic, or it's about reproductive health care, or it's simply misinformation about hormones and what they do, we need to stop this kind of behavior and try to find trusted sources that people can become educated with and value, and most important, access. Really, that's the most important. And I don't have a perfect solution for that. I just think that all of us as providers have to keep speaking out and speaking publicly in a platform like this one so that we can reach more people.
I don't want to end this conversation. I mean, you are just extraordinary, and I'm so grateful for it. I have one last question, and I think you'll love this one. This is your platform today to give women all around the world, of all ages, of all backgrounds, of all cultures, a message. What do you want to leave them with?
I want to leave them with the understanding that being able to assert your bodily autonomy is connected to so many things that we are not in control of, right? So it's economic, it's cultural, it's educational, it's health related, but that the more access to education that we can support, the healthier we will be, and we will have the tools to seek the services we need if we have the right education. It sounds very ambitious, but I think that's ultimately what I want people to remember, and that there is, I think, a cultural change in the willingness to really accept that women's health issues have been marginalized and understudied and overregulated, but that we can all demand a better type of world. We're a majority.
This has been a wonderful conversation. Your story is amazing. Thank you so much for getting under the hood with me today, Dr. Creatura.
Well, thanks for inviting me. And most importantly, I really want to thank all the amazing providers who are out there in platforms like yours, who are setting up telemedicine clinics, who are making sure that people have the information that they need and that it's not cost restrictive. And that's ultimately what I really want to support, because I'm one little tiny piece of the picture, and little pieces are important, right? When I speak to students, I say it's important to speak out and to call out injustice and to point out misinformation. But it's the big picture of having a whole culture that wants to make this happen. And one of the beautiful things about being around for several decades is that I can see how the medical workforce is being transformed. It gives me so much hope for the future when I have medical students who get that.
Thanks for listening to Under the Sisterhood. If you haven't already, please give us a quick rating and review on Apple or Spotify. And make sure to follow us on Instagram, Facebook, YouTube, and LinkedIn so you can hear from more amazing women. This podcast is created and hosted by Under the Sisterhood LLC and Elizabeth Elfenbein, produced by Elizabeth Elfenbein and Matt Butler, and edited by Matt Butler. The music is by Ayla Schaefer. Her song, Rose.